probably the epidural needle. That's probably the one that everybody's like, wow, that seems scary, or that seems big, or, whatever. But then we talk it through. And once we talk it through, then they're like, oh, well, that makes sense. That's not as scary. I understand why it's that way. And it's, not as intense as what I thought it was. I will say, though, the forceps everybody's always drawn to those. They're shiny, they make noise, especially the dads. They always tend to grab a hold of those because they have no idea what they are, and they're making sounds and clanking them. And they, I've had guessed lots of different things as to what they think it is. But that one always is interesting and a good conversation for sure. Imagine this your cervix, okay? Like a little donut, right? I insert this through the cervix, like that. So session 4 is kind of right in the middle of our labor and delivery discussion. We go through all the steps in labor and delivery, and we also kind of go over all the tools, all the instruments, everything that they may or may not see while they're on labor and delivery. And we talk through all those things so they feel comfortable that if they were to see an instrument or a tool that was on our table, that they know what it's for and the reasons that we're using it. And they feel more comfortable that way, and they feel like they have a knowledge base before they go into labor and delivery. We don't have the time in the clinic to show them these instruments. We don't have time to go through them individually. And they really do enjoy that hands-on. They like seeing it, they like touching it, they like seeing exactly how it works. And that also helps, decrease anxiety, decrease stress about labor when you're like, what is that and what are you using that for? We've already talked about that. They know what it's for. They know why we're using it, and they feel more comfortable and they feel more reassured that things are, normal and progressing normally. All we're doing is kind of snagging a little hole in the bag. That's all we're doing.
It honestly just looks like a big crochet hook.
It does. That's exactly what it looks like. Yeah, it looks like a big crochet hook. That's what it looks like. The Amni hook, everybody always says it's a big crochet hook. And that's what it looks like. It totally looks like that. Just in general, they just have good guesses about things. Sometimes people have had a medical history, and so they know exactly what a catheter is, or they know what SCDs are, or oxygen, or any of those things. And then sometimes we have groups that nobody's had any medical history whatsoever, so they've never seen any of this stuff, and they have no idea. So, we get absolute correct answers, and we get absolute off-the-wall answers too.
Does it hurt pretty bad, or is it just like getting a shot, or like your blood drawn, or?
So when you're sitting there and you're like, you'll be hunched over like this so that.
So after everybody's delivered, typically a month to 6 weeks after delivery, we will have another centering session that is reunion. And we come back and we talk about birth stories, and we talk about, what exactly happened with you, or, just tell me what happened. And I will ask that question. I'll be like, is there anything that surprised you? Even though we went over, X, Y, or Z, is there anything that surprised you when you went to labor and delivery? And I've had a few patients, that'll be like, well, they missed the instrument appointment, right? They missed that group. So then they'll be like, I didn't know anything about this, and and on and on. And so then they'll be like, but we did talk about it a little bit when I did come back for the next session, and I did feel better. And I think if I wouldn't have known, I might have freaked out a little bit. So I'm friends with lots of my former centering patients years after they've had their babies, and maybe they're out of the military, maybe they live, halfway across the country or whatever, but I'm still a part of their lives. And I don't feel like I get that near as much it down in the clinic, right? With group or with centering, I can promise them, the same provider is going to be there, the same nurse is going to be there. I can't promise them that in the clinic, So we just get to be really close. We see each other a lot, and we just definitely form those bonds. And the education part, that's a bonus for me and for them. I enjoy teaching. I enjoy, just having these open conversations with patients. And I learn a lot from them too. There's lots of questions that they ask that I would have never even thought of. Dads are great. They ask the best questions, and they just come up with these things, and I'm just like, where on earth did you get that thought or get that idea? But they're great questions, and they start great conversation. The best part about group is me just being able to sit back, relax, and let them actually teach each other. And they gain so much from that. So much.
I'm playing again. Are you like, what is going on?